Hello everyone, and welcome to this Grassroots Health interview with Dr. Linda Rapson. I'm Jen Aliano, Director of Grassroots Health. Dr. Rapson is a medical doctor whose areas of expertise include neuropathic pain and chronic myofascial pain. She began testing vitamin D levels in her patients in 2004 and was shocked to find very low levels among many of them. Today, she continues to advocate for vitamin D in general, not only for pain management, but also for general health. Dr. Rapson will be speaking at the upcoming Vitamin D Symposium, Empowering Health with Vitamin D, in Canada on November 1st, 2004.
In 2004, I started testing people for their blood levels because of vitamin D. And that was because Aileen Burford Mason, who is her background is she got her PhD in immunology, but she knows she's really good at everything. And I met her in 1997, and that began my education about magnesium, vitamin D, you name it. And but the vitamin D thing that I'm upset about is the fact that I was deficient because I went to a dermatologist, told me, a brilliant dermatologist, the best that we ever had in Canada, actually, as far as I know. She said that I was, for skin purposes, I was a blue-eyed blonde. And so I should keep out of the sun. And it wasn't emphasized when I was going through medical school about vitamin D. And so I can remember I would be dodging the sun, the sunroof in my car and all kinds of stuff. It was crazy. And I got muscle weakness myself from it, I think. And then when I started on vitamin D because of Aileen, I had been on it for some time, and then I decided my hands were weak, and I decided that it was going to be, if I had to hang on to something to save my life, I'd be dead. So I started doing the Chinese balls, the Chinese balls, the healthy balls, and within days I could wring out a face cloth, and I was doing that just for the pure joy of being able to do it because I was weak, So I think I had a personal experience with it. And that was the beginning of my understanding of it. And I really feel really passionate about it. And I'm very upset that my medical profession remains ignorant. And just quite frankly, I think that big pharma actually groomed the medical profession over decades to think that nutrition was garbage. And they've done a really good job of it. It's a really good job.
And they're still trying.
Well,
Thankfully, we've got scientists like you, doctors like you, who are continuing to push for the information about vitamin D to stay unburied and get into the hands of more practitioners.
Well, during COVID, it turned out to be the most important thing. If your vitamin D level was good, you were much less likely to get sick and die.
So at the time that you learned about vitamin D for yourself, did you start implementing it into practice right away? And what were you, if you could just briefly describe what type of practice you run, what type of patients you work with?
Okay. Well, my training was the standard training in the old days. We were GPs, general practitioners, not family physicians. And I worked in that capacity for almost 10 years before I discovered acupuncture. And I was just blown away. I was very naive. If I had been less naive, I would never have had the courage to go ahead and get really into acupuncture, because I would have realized that I thought all of the medical profession would be thrilled to bits to know that you could you could help people with conditions that weren't able to help them with before. And so I was very, well, naive is the only word to have to use, I think. And so I started, because I got really good results from my introduction to acupuncture was a 3-day course that was put on for MDs. And after that 3-day course, I started getting incredible results with pain. And I was very excited about it. I was like a kid in a candy store, it was wonderful. And so, and then I got really very much into it, to the extent that the next year I left my general practice and went to work in a clinic that was started by the Acupuncture Foundation of Canada, which is where I had learned acupuncture. And we had a PhD guy from the King Lu, who came up from the States, and he was trained in acupuncture, I think in France actually, and so we were taught it was an abbreviated version of traditional classical acupuncture. And then later on, not very later on, a couple years later on, our teaching was taken over. Our main teacher was Joseph Wong, who was from China, but was a specialist in physical medicine and rehabilitation. And so he developed an anatomical approach to acupuncture that made a lot of sense and is very helpful when it comes to treating myofascial pain. And so then we had more training. I've had training in all aspects of acupuncture, including more recently scalp acupuncture with Jason Howe we had him up from the States to give it. That was in 2012. And then I was again, that is so powerful that I was again like a kid in a candy store, because the stuff, what you can do with scalp acupuncture is brilliant. And that, of course, as you know, is based on neuroanatomy. So we have and then I got involved in there was a physiotherapist who took our training, which she started in 1989. And by 1992, she worked at our rehabilitation hospital for spinal cord injuries. And that was where we started. We got the chance to do a pilot project to treat them for pain. And that was in let me see, 1992 in June, we started. Within 2 weeks, we were called miracle workers around the hospital, because we were just taking, but we couldn't get rid of the generalized neuropathic pain. And that was, we put together, we had some doctors who came from China in September of that year, 3 months after we started. And they came to find out how to do physiotherapy with spinal cord injuries, because they were good at surgery, but they weren't good at that. Anyway, we discovered in a video they brought. I saw that it was a long shot, so I thought it was a guy doing acupuncture, and he was doing it on the top of the person's head. So I asked about it and said, "Oh, that's for the burning pain." And so we started. That was the beginning where we started with this. We had a guy who had he was a complete quadriplegic at I think C5, and he had terrible. We got rid of his neck pain and stuff. That was easy because that was muscular. And then we tried this thing on him, and his pain went from in 5 minutes, it went from 7 out of 10 down to 3 or 4. And that was a beginning of us starting this. There's 4 points that we use on the head,
right?
Starting with yin tang here. And we started getting these, through the wonderful results. The results you get now aren't as good. And the reason is because now the patients are being put on drugs that they weren't being put on back then. Besides, marijuana is legal in Canada everywhere. And back in the early days of doing this in the 90s, we had one of our patients, I was really annoyed. They kicked him out because they found marijuana on him. And I was really keen on treating him because by that time, I was into the myofascial trigger points, and he could feel a sensation. He had no sensation in below his level, but he could, when I poked him on the trigger point, there was something that was different. And when I needled it, I helped his pain. And then they kicked him out because of the marijuana. So I wasn't happy about that. So we're in a different world now because the pharma has now convinced the people in the rehab, in the spinal cord rehab, that it's a good idea to put them on the drug just after they get their injury. And it makes a difference. It blunts the effectiveness of the acupuncture. That's just my opinion from what we've done.
Observation. So it sounds like you've been specializing in pain since the 90s. Is that correct?
Oh, yeah. Well, actually, yeah, no, earlier than that, really. But for sure, yeah.
And when you introduced vitamin D, what differences did you see?
Well, the first one that stands out to me is I had a man who came to me with low back pain, and I examined him, and I couldn't reproduce the pain. And so I didn't know what to blame it on. And I knew that there was a possibility that it was weak muscles from low vitamin D. So I twisted his arm and said, can we hold off on the acupuncture, and we'll try to see what happens when you take vitamin D. And he agreed to it, but it took about 3 months. His pain had come right down. But he wanted acupuncture, so I treated him a couple times then. But I was convinced that was what was going on there.
Were you measuring levels at that time?
Vitamin D, yes. And his level was 30 something. Oh, we have a different, we use milliliters, what is it?
Nanomoles per liter.
Nanomoles per liter. And so it was I think it was 35 or 36, which for you would be what? 12?
Yeah, about that.
Yeah.
2.5 difference.
So yeah, so that was I was able to monitor that. And then Aileen, she kept talking about being able to get up out of a chair and that kind of thing. At the beginning for several years, I didn't have a really good example of the weakness until I had a woman who had she had pain. You know how many people who have low back pain have trigger points in their gluteal muscles. It's the glutes. That's what it is. It's got nothing to do with their nerves or anything. It's got to do with that. And I put her on. It was early days, so I had told her to take 1,000 of vitamin D after she got her blood drawn, and her blood test came back at 28, and she had started when I first saw her. She was walking with a walker, and she could hardly get up. It was a real struggle for her to get up. And within a matter of weeks on the vitamin D, she she stood up.
Wow.
That was a real turning point for me too, because Aileen had been talking about that, but I hadn't had a case where I could say that was what happened. So that's why I got so interested in this muscle strength. And And because of our system in Canada, like we have people who the government subsidizes what do you call them? Not wheelchairs, but scooters for people who are weak. They pay 75% of it. Well, I'll bet you anything that 90% of those people are deficient in vitamin D. And that would, I'd love to do a study on that because you could save the government a ton of money,
Right.
although they don't care. But
Do you see specific muscle groups that respond more to vitamin D supplementation than others?
oh, I couldn't say that. I haven't done formal research into this at all. This is all anecdotal, individual cases,
But these are cases that you've seen over the last, what, 30 years or so?
Um, yeah, I met Aileen in 1997, and the first thing that we talked about was magnesium,
Oh,
because I said to her that I had figured out um, that a lot of chronic pain was related to muscle, and she said, "Oh, maybe they're magnesium deficient," and I said, "Oh, well, if that's the case, what? Shall I get their serum magnesium level?" And she said, "Well, you could, but it wouldn't be very helpful." It would, it would because what's in the blood doesn't tell you what's in the tissues.
right.
And that once you understand that, you know that well, I still do the blood test just to have a number.
Mm-hmm.
But I know that the thing is it's got to have it's got to be but you got to anyway. So,
Do you, do you have a specific protocol that you follow in your practice with vitamin D? And do you always supplement with the same amount? Do you base it on a blood level? Do you recommend co-nutrients with magnesium, or
with
explain a little bit about how you approach?
what was the last thing you said you referred to?
Oh, do you recommend co-nutrients like magnesium when
Oh,
you give vitamin D?
oh yeah. Um, yes, I what I do is I test everybody. Um, although the government, we had a big battle over it was free for everybody for 5 years. And then they just I think what happened that was that the we have private labs that are get funded by the government. They're privately run, but they get that. And I think what happened was that they give I think what they do is they give them a pot of money. They're not going to do, like a bill for each test. They say, okay, here's so many $1 million, do the test. And the labs objected because they went from 45,000 tests a year up to 800,000 or something after we started a course, Nutrition for Docs, that Aileen was our main teacher at. We started that, and the people who came to it, we told them, test them. And they came back and said, "Oh, I've been testing everybody," and how many are really, really low. And then that's when the numbers went up, and the drug companies went after, or the lab companies didn't want to have to do it. So it's up to our discretion to either lie and say that they need it because they say if they're deficient, if they may be deficient, it's stupid. They because they have malabsorption. Well, you don't get much vitamin D from food, do you? Hardly any. So they have all kinds of excuses for, not knowing that they just don't know enough.
Yeah.
But
And about what percentage of your practice comes in deficient, and what do you define as deficient versus optimal?
well, I there's no question that people who are dark skinned or people who are obese are much more likely to be deficient. There isn't any question about that. And that's a good, a good thing for everybody to know, because there's a lot of things that that dark-skinned people are more susceptible to than light-skinned. And it's not rocket science. It's got to do with vitamin D. Because they don't, well, why would you go? The white people are all trying to get tanned, and the dark people are keeping out of the sun, because why would they bother? And so they tend to have some of the lowest levels. The other group who have low levels are the Asians, because they don't want to look like a peasant. That's their hang up. And I've said that, how many Chinese people I've said that to, and they all say, "Oh yeah, you're right." Because they have an umbrella to keep the sun off them. They do that. Or they cover themselves up. And so they don't know and so I have to say that some of the lowest levels I've encountered have been in Chinese people.
Wow.
So and with dark-skinned people, it's a given pretty much. You'd probably hardly ever find somebody with a really good level who's dark-skinned.
Especially in Canada.
Well, we're 43 latitude north here. And we're, Canada has the highest incidence in the world of MS, multiple sclerosis. I mean, you could wipe it out. This vitamin D thing we're doing in November is a brilliant idea, because if you could possibly get it through to the public, how important it is, you might not convince the medical people, because they don't want to hear it.
Mm-hmm.
And the drug companies certainly don't.
Yeah.
But what they're doing now is I noticed very recently that big pharma seems to be investing in high-end supplements. I got a thing in the mail not too long ago that convinced me of that they're talking about what do you call it? Glucosamine. Glucosamine for your joints?
Mm-hmm.
Oh, yes. They say, well, glucosamine, the regular one, I forget what it is, isn't as good as this version of it. You should get all your patients on. It was a letter. A letter came in the mail to me from this company. And then I saw ads on TV where they American ads where they were pushing some other kinds of supplements.
Yes. Mm-hmm.
They don't care. Like they have no ethics at all. All they want to do is make money. So.
Well, I wanted to rewind just a little bit and just clarify, especially based on your own personal story about vitamin D, that even us with lighter skin Caucasians, we are also at high risk of vitamin D deficiency, because we do put sunscreen on when we go out. But I just wanted to clarify that everybody across the board, especially if you're not supplementing, what do you think the risk of deficiency is?
Oh, it's 100%, isn't it?
Mm-hmm.
It has to be. I recently, there was on the CBC on the radio. I was in my car. I heard this thing, a phone-in thing, and it was all about vitamin, or about sunscreen. And the sunscreen thing, they didn't even, nobody mentioned vitamin D. And yes, we have, where I am here, there's a lovely little kid next door, and she's only year and a half or so. And I asked how much vitamin D they had her on, and they don't have her on it. So I will now be getting, before we leave here, I will have them, that will be taken care of, because the level of ignorance is ridiculous.
Yeah. Right. So, back to your practice and vitamin D levels that you prefer to see your patients having.
Okay.
What is the target range that you see, or that you would like to see your patients reach?
I like them to get 130 or higher.
Okay.
And that was during COVID, there was a consensus that that was, based on the available evidence, that that was ideal.
And
But
that's nanomoles per liter, just to make sure everybody's
that's
aware. And that's about 50
that's 50,
nanograms per milliliter.
it's well, 50 is 125.
Okay.
I'm very surprised if I like sometimes I'm so sure that somebody's going to be deficient that I've retested them when it shows that they were in the no so-called normal range. And the normal, and then it comes back the same because so there are people who take it on better than we, at the one end, there's the ones who have to have 10,000 units a day. And at the
Hmm.
other end, there's ones that can manage with much less.
Hmm.
So um, I think you can't depend on anything but the blood test. And when I first, this shows you how long ago it was. When I first started testing, the lab said that it would, if it was above 25, it was okay.
Wait,
Yeah,
25 nanomoles per liter?
yeah, which would be 10 of yours it was okay. And I knew it wasn't. And I kept testing people. And then Aileen and I had lunch with Reinhold Beeth, who's he's a world authority on toxicity of vitamin D. And I said to him, can you get this range changed? And he said, yes, but it'll take a year. So sure enough, a year later, all of a sudden it went from 25 up to the minimum of 75. And he put the maximum at 250. And he pulled that out of a hat. And because he had many times, I'd heard him, he said that he didn't know what toxic was. I mean, well, he knows that we know that toxic is, if you're only toxic if your level is really, really high and your calcium level has gone up. We knew that. So he he said he had a study that he did with people with MS where they started out, they got their what their level was. Then they started giving them 1,000 a day, and then they went up gradually. And he got them up to taking 40,000 units a day of vitamin D, and nobody's calcium went up. So I remember him telling me one time that, he didn't know what a toxic level was. Maybe it's 750, something
Right.
like that.
If there was a key message that you could get out to other practitioners, to individuals, or to the public health authorities about vitamin D, what would that key message be coming from you?
Well, my key message would be that ideally they should be tested and monitored that way. Barring that, I think that they should be on 4,000 units a day. And they got to take into account in the summertime, if they're putting on sunscreen, they have to keep doing it. They can't just assume, oh, well, it's sunny out, so I'm fine in here.
But you've never personally seen toxicity in your practice or,
No.
right. And just a couple more questions. You mentioned magnesium. Do you recommend magnesium to all of your patients with the vitamin D?
I pretty well advise everybody to take magnesium. They usually have some symptoms that are related to low magnesium.
Mhm.
I have a poo chart, the the Bristol stool chart that I keep, that I show them, and they think they're not constipated, but they are, some of them. you know, there are a number. Do you know that? Are you familiar with
Yeah,
that chart?
the different pictures that it shows. Yes.
One's the one and two. I mean, they're really for sure. Well, especially one. I mean, it's like a rabbit or a, you know, and yeah, and people are, well, as Aileen says, you know, the one thing that people never give up. Like lots of times you get people on supplements and they go off them.
Mhm.
But the one thing that most people won't go off is their magnesium because right away they get constipated.
Right.
So that's and you know that we were in medical school, we weren't taught anything about that at all,
Right.
even in the old days.
Because it's
Although,
nutrition.
but we grew up with having um to in the winter time we had to take vitamin D.
Was it the cod liver oil?
Yeah, starting in the
Yeah.
fall.
Yeah. Yeah. I hear that from a lot of people. And it's interesting that fell to the wayside.
Well, you know, the thing that's so interesting is that it got rid of rickets in the whole of Canada except for Quebec. Quebec did not have a mandatory that, you know, in all the other provinces, as far as I know, kids who didn't have it at home were given it at school once they knew about it.